I've seen a lot of people come in after a significant loss. Me personally, came in through a significant loss, was actually the reason why I was kind of forced into the chair into the first place. Fast forward, lost my mother, my best friend. And the two didn't, obviously my mother is the most significant person in my life, right? That loss was different than the one that forced me into the chair, who again significant. It was my best friend. And he was lost in a very tragic way, but the way my brain handled it both times completely different. Can you speak on that?
Sure. And Kyle, first off, I'm sorry for your losses there.
Thank you.
That is a hard thing to go through at any age. Some of the more interesting work about sort of how grief and depression are similar and how they're different really are some studies that came out of UC San Diego. Sidney Zissik was the senior investigator on those things, and there are similarities and there are differences. I'm not aware of a study that has actually looked at TMS for grief without depression as part of it.
Okay.
But I can tell you from my own experience, having done TMS since 2009, that very often in the course of treatment, something catastrophically awful will happen to a person.
Yeah.
They may suffer a loss of a loved one. There may be a loss of a job, death of a pet, loss of a
significant other,
a spouse who says, "I'm going to get divorced."
Uh-huh.
Bad things happen like that in the midst of doing a course of TMS. And what people have often told me is that, while they say, I'm not happy, but I'm resilient.
Right.
And they will often say, I didn't spiral down like I think I would have
Mhm.
done without the TMS.
Mhm.
I didn't dissolve into tears the way that I think I ordinarily would have. And that sort of that resilience, that ability to bounce back is something that I've heard from patients over and over again.
Yeah, I'm walking testament to that one. Can TMS make depression worse?
A question that's a question that patients have asked me, and I have no data to say that the TMS makes things worse. Very often, if TMS isn't effective for a person, the natural course of depression is that often it may get worse. Over
That makes sense.
over the span of many weeks. And if you're doing something that just isn't the right intervention, it's not going to hold it back from getting worse. But I've not seen TMS actively make a person feel worse.
YouTube, do yourself a favor. Check out this next video right here.
That's the one to look for.